So before we get into the audience questions, can you just tell us more about like blood disorders and cancers in children? Like what are the most common blood disorders and cancers?
So, this is a vast topic, and I'll try to kind of summarize it to the best of my ability. As I said, children, when we talk about children, we really want them to be healthy all the time. And when we talk about the disorders which we treat, this is like every family or every parent's nightmare. But what I like to start with is many disorders which we deal with are quote unquote benign, meaning that they are not cancerous. This ranges from just simple anemia like iron deficiency anemia, which is very prevalent in the toddler age group, which really is a very common disorder, mostly occurs due to excessive milk consumption, cow's milk consumption. So starting from that, then we also deal with disorders of other blood cell lines like low platelets. There are different kinds of syndromes or disorders which can be caused by low platelets. Immune thrombocytopenia is another disorder which we see a lot. It's very common. We also see neutropenia. Basically, if you break it down just for the audience, there are three types of blood cells which are produced in our body, and bone marrow is the factory of these blood cells. So factory produces this blood cell which goes into the blood. These are white blood cells which fights infections, red blood cells which carry oxygen to different parts of the body, and platelets which stops bleeding. When there is an injury, platelets are the cells which goes there and stops the bleeding. These are the three predominant cells which really is extremely important for well-being. Whenever anyone gets common blood count done, which is a complete blood count done, CBC, they will see that in the CBC report. White blood cells, red blood cells, platelets. So we essentially deal with any disorder which have any of these cells abnormal. And as I said, it starts from anemias, thrombocytopenia meaning low platelets, neutropenia meaning no low white blood cell count, to a range of array of cancers. The most common pediatric cancer is acute lymphoblastic leukemia, which is the most common cancer we deal with. The second most common cancer in pediatric age group is actually brain tumors. Many of the brain tumors are very curable and could be cured only by the means of surgery, and some of them require further treatment. There are other cancers as well we deal with, common ones being neuroblastoma or Wilms tumor, and there are rarer bone and soft tissue sarcomas as well, which we deal with. We also provide care for patients who have risk factor for bleeding or clotting, and we help patients with bleeding disorder. If they have some of the proteins missing, we treat those patients as well, prevent their risk of bleeding. And we also help patients who have developed some unexpected clotting. So we have a very large practice which varies in different areas, and many times this are something is very scary. It's very important to identify the right doctors, and really going to the bottom of it is very important.
Mm-hmm.
So that's kind of a very overview of what pediatric hematology and oncology entails.
Mm-hmm. Thank you so much, Doctor.